I got my MPH in May of 2009. But in my time at UNC, my big interests were in reproductive health and reproductive justice and in global health. Throughout my training in my first year of my MPH program, Melanie actually came to a number of our classes, and she did great presentations on how to use PubMed and how to research. And I relied really, really heavily on all of those skills while I was in India. The HSL was, I don't know what I would have actually done. I don't think I could have done my internship actually, and actually been able to produce a literature without the support that I got from here.
When I came, I was really impressed with, in terms of my use of the library, how accessible the library has been to me here. My work is mostly based in East and Southern Africa, and I do research on HIV in Tanzania and South Africa primarily. I also collaborate on some studies in the Congo and in China. But my own research is focused on looking at some of the barriers to accessing services, particularly for women. So some of the gender issues around women's use of HIV prevention services and treatment services. I've had much more contact with the library than I ever had before. It's much more present, I would say, here than I've seen in other places, and I've appreciated that a lot. The kind of literature I tap into is not in the traditional public health, medical journals. It's in social science databases and journals, and I think you've been very good about helping me look in other types of databases and in other places for the kind of literature that's really going to inform the work that I do.
And as part of my responsibilities, I cover our global initiatives and just trying to highlight global throughout our academic programs. But we consider HSL such a key part of how we are able to do our jobs in health affairs because of the focus. It truly is an outstanding library. In my busy day, I don't have time to do the depth of searching, and they just already know where it is. What we find really helpful is the level of teaching that we get from the library, of your readiness to come over and do faculty development. All orientations that we do for new faculty include a trip to HSL and a personalized introduction to how to use the library.
I'm studying how people eat and drink and move and how it's changing. And I have large cohort studies in a number of countries. I'm getting 2 or 3 articles a day from your system. It's enormously helpful, the major subscriptions we have to major sets of journals. An awful lot of those journals are no longer based in the U.S. and they're global.